So, in 2002, there was this major clinical study published in Obstetrics and Gynecology, and it found something pretty wild.
Oh, the flaxseed trial, right.
Yeah, exactly. They found that eating 40 grams of ground flaxseed every single day was like just as effective at stopping menopausal hot flashes as pharmaceutical hormone replacement therapy.
Right. But then, you fast forward a bit, and you have the gold standard Cochrane review looking at, 30 randomized trials of those exact same plant compounds.
And they basically declare them mathematically no better than a sugar pill.
Yeah, which is just the ultimate medical paradox, right?
It really is. I mean, how can both of those things be true?
Well, you have entire populations with these lifelong traditional diets who absolutely swear by these foods for hormonal balance.
Hmm.
And then you have strict Western clinical trials completely failing to replicate those results in a controlled environment.
Okay, let's unpack this. Because, you listening right now, you might literally be staring at a bottle of expensive red clover supplements or like pouring soy milk into your coffee.
Wondering if it's actually doing anything.
Exactly. Wondering if you are actually doing anything to manage perimenopause or if you're just participating in a very expensive nutritional placebo effect.
Which is a totally fair question.
So today, our mission for this deep dive is wading into the biological mechanics. We really want to figure out if phytoestrogens, these compounds found in soy, flax, and various botanicals, can genuinely balance wildly fluctuating hormone levels.
And to do that, we are synthesizing data from a bunch of places. We've got clinical reviews by the Royal College of Obstetricians and Gynecologists, some pretty strict oncology guidelines, and targeted botanical studies.
Right.
But to really understand why the data is so polarized, we have to kind of skip the basic definitions and look straight at the molecular architecture of these plants.
Yeah, because structurally, phytoestrogens are just plant molecules that happen to look an awful lot like endogenous estradiol, right?
Exactly. They're similar enough in shape that they can physically fit into the estrogen receptors inside human cells.
But it's not a perfect fit, is it?
No, it's not at all.
Like, if your body's natural estradiol is the master key that is, perfectly machined at the biological factory to slide into the lock and turn smoothly, are phytoestrogens basically like a bump key?
Oh, I love that analogy. Yes, they're exactly like a bump key. You can jam them into the cellular lock, but they just don't turn it quite as well.
So the mechanism of action is much weaker then.
Right. The affinity is different. And so the resulting cellular signal is vastly attenuated. But the why behind that interaction gets highly specific.
Because human cells don't just have one universal estrogen lock, right?
Exactly. We actually have two primary types of estrogen receptors, ER alpha and ER beta.
And those receptors have like incredibly different jobs depending on the tissue they are located in.
They really do. So ER alpha is the receptor primarily driving cell growth and proliferation.
Okay.
It is heavily concentrated in breast tissue and the endometrial lining of the uterus. So when a molecule binds to ER alpha, it basically signals those cells to multiply.
So ER alpha is kind of like the gas pedal for tissue growth.
Exactly. But ER beta, conversely, is concentrated in the bones, the brain, and the cardiovascular system.
Oh, interesting.
Yeah, and its primary role is modulating inflammation, initiating programmed cell death, and exerting these protective regulatory effects on the tissue.
Right. So if ER alpha is the gas pedal, ER beta is more like the governor just regulating the whole system.
Perfect way to put it.
Yeah.
And what's fascinating here is that phytoestrogens, specifically soy isoflavones like genistein and daisane, actually prefer binding to the ER beta receptors.
Wait, really? They don't bind equally to both locks the way our own estradiol does?
Nope. They have a profound structural preference for ER beta.
Oh, wow, which means they offer a completely alternative signaling pathway.
Exactly.
By heavily favoring ER beta, a molecule like genistein could theoretically trigger those protective cardiovascular and bone density benefits without aggressively slamming the gas pedal on the ER alpha receptors in breast tissue.
Right, it basically acts as a tissue-specific modulator. But before we just assume a bowl of edamame is a perfectly targeted therapeutic, we have to address this massive biological toll booth standing between the food on your plate and the receptor in your cell.
Oh, the digestion part.
Yeah, because the phytoestrogen itself isn't always the active agent.
Okay, here's where it gets really interesting. I was reading through the nutritional analyses, and the biological variable that dictates whether this works or not isn't actually the plant at all.
Nope, it's your microbiome.
Right. To get the most estrogenic bang from soy, your gut bacteria have to metabolize those isoflavones into this highly potent secondary compound called equal.
Yeah, equal is basically this non-steroidal supermetabolite.
Hmm.
It has a significantly higher binding affinity for ER-beta than the original soy compounds do.
Wow.
And it stays in the bloodstream far longer.
Yeah.
But there is a pretty major catch.
The human body can't produce equal on its own, can it?
Exactly. It relies entirely on specific strains of intestinal bacteria to perform that chemical conversion.
And the clinical data on this is wild. It shows that only about 30% of Westerners actually harbor the necessary gut microbes to make equal.
Right, compared to like over 50% of individuals in Japan who naturally possess this bacteria.
Which completely reframes how we view nutritional supplements. So for you listening right now, your digestive tract might literally be deciding whether or not a supplement works.
It is the ultimate gatekeeper.
Yeah.
I mean, if you lack those specific bacterial strains, maybe due to a lifetime of highly processed, low-fiber Western diets or just generational overuse of antibiotics,
Yeah.
you can take the highest quality soy isoflavone supplement on the market, and your body will simply excrete it,
The Daidzine never converts to equal. It just becomes really expensive urine.
pretty much. And realizing that the microbiome dictates efficacy is exactly the lens we need to understand the massive clinical trial tug-of-war.
Because knowing that gut bacteria plays such a huge role perfectly explains the wild inconsistencies in the data.
It's arguably the most frustrating part of navigating menopause treatments. You look at decades of epidemiological data showing Japanese women eating a traditional soy-rich diet from childhood, and they view menopause as this completely natural transition.
Right, and they report vastly lower rates of hot flashes.
Exactly. But then you have Western clinical trials completely failing to prove it works.
Okay, but I have to push back on how Western medicine investigates that epidemiological data. Because when you look at that massive Cochrane systematic review, the one analyzing 2,700 participants,
Across 30 randomized trials, yeah.
right, and their conclusion that phytoestrogens perform no better than placebos, it seems fundamentally flawed based on the trial design itself.
Well, yeah, because they are looking at, like, a 12-week intervention.
Exactly. And they're isolating the isoflavones or lignans into highly processed extract pills, stripping away the entire matrix of the food and just handing it out as an acute intervention.
To Western women who likely don't even have the equal producing bacteria to begin with.
Yeah. Yes. You can't take a population that lacks the biological machinery to process a compound, hand them an isolated extract for 12 weeks, and then confidently declare the compound itself is biologically inert.
No, you really can't.
That is a failure of the trial design, not a failure of the phytoestrogen.
I totally agree. I mean, it really highlights the limitation of applying a pharmaceutical testing model to a nutritional systemic habit.
Right.
The Japanese epidemiological data isn't just measuring isoflavone intake, it's measuring a lifelong dietary pattern intertwined with genetics, specific microbiome adaptations, and an entirely different cultural perception of menopause.
Viewing it as a natural transition rather than, a medical crisis to be suppressed.
Exactly. But to be fair, even within those flawed Western trials, there are measurable biological wins hidden in the data.
Oh, for sure. Like, the clinical reviews do note that consuming between 40 and 80 milligrams of soy isoflavones daily has been shown, in some specific localized studies, to reduce hot flash frequency by 10 to 30%.
And for a patient experiencing severe vasomotor symptoms like waking up drenched in sweat multiple times a night, a 30% reduction is a highly clinically significant improvement in quality of life.
Oh, absolutely. So let's talk about the specific evidence for flaxseed, because the timeline of the data there is just a total roller coaster.
It really is.
We mentioned that 2002 study showing 40 grams of ground flaxseed was as effective as HRT for mild symptoms. But then subsequent major studies in 2005 and 2010 found zero statistical difference from a placebo.
Right. So flaxseed is the richest dietary source of lignans, which are a different class of phytoestrogens than the isoflavones in soy.
Okay.
And the inconsistency in the clinical data for flaxseed really comes down to bioavailability and baseline metabolic health. While the hot flash data is highly variable, the studies consistently demonstrate that lignans offer measurable improvements in lipid profiles and mood regulation during perimenopause.
Interesting. And then you have botanical extracts like red clover, which supply moderate isoflavone.
Yeah, for mononetin and biochanin A.
Right. But the RCOG guidelines classify red clover results as pretty mixed. Like some meta-analyses show a modest reduction in vasomotor symptoms, but again, that Cochrane review found no overall difference.
Right, it goes back to the bump key analogy.
Yeah,
It's a key that only turns the lock for a highly specific subset of people.
makes sense. And we also have to address dong quai, used in traditional Chinese medicine.
Yes, Angelica sinensis. It's frequently used for hot flashes and vaginal dryness. But this is where the biological potency of these plants becomes a serious clinical concern.
Yeah, because if these plant compounds are potent enough to mimic hormones, successfully bind to a cellular receptor, and potentially halt a systemic hot flash, they absolutely must be potent enough to cause unintended side effects.
Exactly. The mechanism of action is identical to a pharmaceutical.
So it's kind of like a crowded parking lot, right? If phytoestrogens are taking up all the parking spaces, the receptors in the cell, aren't they blocking other important medications from parking there?
That is a critical point.
Hmm.
Because if these phytoestrogens are acting on the ER-alpha and ER-beta receptors, they are essentially functioning as SERMs.
Selective estrogen receptor modulators.
Right. They exhibit both estrogenic and anti-estrogenic activity. They can act as an estrogen agonist in one tissue, turning the signal up, but then act as an antagonist in another tissue, blocking the signal.
Oh, so it's like a biological thermostat.
Yeah, the thermostat analogy is the exact mechanism of a SERM. Depending on the tissue environment, they might turn the heat up in a cold room, like helping maintain bone density.
But then turn the air conditioning on in a hot room?
Precisely. Because they occupy the receptor site, they strictly dictate what other molecules can or cannot bind there.
Which brings us to the strict medical warnings extracted from the oncology guidelines.
Yes, this is so important.
Because the epidemiological data shows that a traditional soy-rich diet from childhood actually lowers breast cancer risk. But the oncology guidelines strongly advise against taking highly concentrated phytoestrogen supplements if you have a history of hormone-sensitive cancers.
Right, like breast, ovarian, or uterine cancer. The key distinction here is between whole foods and isolated high-dose extracts.
Because of the competition for receptors?
Exactly. If a patient is taking a drug like tamoxifen or an aromatase inhibitor, which are medications designed to aggressively block estrogen receptors and starve a hormone-positive tumor, introducing high doses of phytoestrogens creates direct biological competition.
Wow, so the phytoestrogens flood the bloodstream and compete for those exact same ER-alpha receptors in the breast tissue.
Right.
And even though they are a weaker bump key, if there are enough of them, they can physically block the life-saving cancer medication from binding to the receptor.
They completely override the pharmaceutical blockade.
Yeah.
And that is exactly why medical bodies warn against supplement pills, which deliver these unnaturally massive doses of isolated isoflavones that you could just never physically consume through diet alone.
That is terrifying. And the interactions aren't just limited to cancer therapeutics, are they?
Not at all.
I saw in the clinical guidelines regarding thyroid function, there's a surprising interaction. Soy can actually block the absorption of levothyroxine, a really common thyroid medication.
Yes, it's a direct mechanical interference. Soy protein and certain isoflavones physically bind to levothyroxine in the gastrointestinal tract.
Oh, wow.
Yeah, they sequester the medication, preventing it from crossing the intestinal wall and entering the bloodstream.
So someone managing their thyroid could be taking their medication perfectly, but if they swallow it with, like, a glass of soy milk, the body simply doesn't absorb the drug.
Exactly. The clinical mandate is that you must wait at least 3 hours after taking thyroid medication before consuming any soy products to ensure proper absorption.
That's such a crucial practical tip. And we cannot overlook the bleeding risks associated with the botanical extracts we discussed, specifically dong quai,
Right, because it contains natural coumarin derivatives.
which are the exact same class of compounds used in pharmaceutical blood thinners, right?
They are. Coumarins interfere with vitamin K-dependent clotting factors in the liver. They basically inhibit platelet aggregation.
So it's an anticoagulant.
Very much so. The anecdotal reports in the clinical literature note severe complications during dental procedures or surgeries because patients often omit herbal menopause supplements from their medical history forms.
Just assuming they're harmless.
Right, not realizing they are actively taking a potent anticoagulant. If we connect this to the bigger picture, it shows exactly why clinical experts, like Professor Edzard Ernst in the sources, warn that natural does not automatically mean risk-free.
Because these plants possess genuine, measurable pharmacological power that alters systemic chemistry.
Exactly. Which raises an important question about how we should actually utilize them. I mean, if isolated high-dose supplement pills carry such severe risks of drug interactions, the clinical consensus shifts entirely back to dietary integration.
So what does this all mean? How do you, as the listener, practically build these foods into your daily routine to harness the potential benefits while minimizing those risks?
Well, it requires understanding the physical mechanics of digestion, really starting with flaxseed.
Right, because there's a crucial mechanical detail from the sources regarding flaxseed. The lignans, the primary phytoestrogen compounds, are basically locked inside the outer shell.
Embedded inside the hull, yes. And that hull is made of an incredibly dense, fibrous cellulose structure that human digestive enzymes simply cannot break down.
I love this part. It's like swallowing whole coffee beans and expecting an espresso.
That is exactly what it's like.
If you just sprinkle whole flax seeds over a bowl of yogurt, they're going to travel through your entire gastrointestinal tract completely intact. You are getting zero lignans.
Zero. The physical barrier must be mechanically destroyed. You have to grind the flax seeds to make the active compounds bioavailable.
Okay, so ground flaxseed, how much?
The dietary playbook, based on the studies that show the highest efficacy for symptom management, suggests aiming for about 40 grams of ground flaxseed daily.
Which is roughly, what, 3 to 4 tablespoons?
Around there, yeah. You can blend it into a smoothie or, mix it into porridge.
And if you are utilizing soy,
Aim for moderate dietary portions of whole soy foods. Things like tofu, tempeh, or edamame. A standard serving will provide that target range of 40 to 80 milligrams of isoflavones.
but the mechanical digestion of these foods requires a secondary biological support system, right? Hydration.
Oh, massive hydration is key. Flaxseed is not just a delivery mechanism for lignans. It is a profound source of soluble and insoluble fiber.
Right, it exerts a heavy osmotic effect in the gut, drawing water into the intestines to create a bulk-forming laxative effect.
Exactly. So if you suddenly introduce 40 grams of ground flaxseed into your daily diet without a corresponding increase in water intake, the fiber basically acts like concrete.
Oh, no.
Yeah, you risk severe cramping, bloating, and potential intestinal blockages. The systemic hydration is non-negotiable.
Wow. And that requirement for systemic support really mirrors the broader holistic approach seen in the traditional Japanese data, doesn't it?
It does. They aren't treating a bowl of miso soup as a targeted pharmaceutical intervention. The dietary habits are inextricably linked to a culture that integrates stress reduction, regular physical activity, and just a fundamentally different psychological approach to the aging process.
Because no singular food item, regardless of its isoflavone concentration or binding affinity to ER-beta receptors, can unilaterally reverse weight gain or cure mood swings without a holistic foundation of metabolic health.
Right.
We started today trying to find a clean binary answer. We wanted to know if these plants work or if they don't. But what we found is this highly individualized biological ecosystem.
Yeah.
Your specific cellular receptors, the unique strains of bacteria currently living in your gut, and even the mechanical way you prepare your food all dictate whether a phytoestrogen acts as a therapeutic tool or just passes through your system.
It really requires us to abandon the pharmaceutical mindset when approaching nutrition. The science validates that these compounds exert real influence over our hormonal pathways, but they demand a localized bio-individual approach rather than just taking a mass-marketed supplement pill.
Well said. And it leaves you with a really fascinating concept to ponder on your own. We've seen that Western clinical trials struggle to prove the efficacy of phytoestrogens, often because they isolate the compounds into pills and give them to people lacking the right gut bacteria.
Right.
But what if the inconsistency in the science isn't a failure of the plants, but a failure of our modern medical paradigm?
Well, that's an interesting thought.
Like, what if we are trying to treat nutrition like a pharmaceutical drug, entirely missing the point that true hormonal harmony requires a lifelong, synergistic relationship between our diet, our culture, and our microbiome?
I mean, if the ultimate barrier to efficacy for Westerners is the lack of equal-producing gut bacteria, what happens when personalized medicine finally catches up?
That's the dream, right?
Exactly. We might not be far from a future where, instead of blindly taking a soy supplement, your doctor sequences your microbiome and prescribes a highly specific probiotic, a literal bacterial culture designed to repopulate your gut and finally unlock the pharmacological power of the food you eat.
Bridging the gap between ancient dietary wisdom and modern clinical science. Thanks for joining us on this deep dive.